Of a second unit of blood, a patient blood pressure is noted to have risen from 90 to 44 before first unit to 124/60. The nurse should therefore carry out the following. A. Carry on the transfusion without change. B. Stop the blood immediately as a reaction is suspected. C. Slow the rate of transfusion to lower blood pressure. D. Increase the transfusion rate. The answer is A. Carry on the transfusion without change. Question number 5. A nurse is assessing an adult patient for peripheral cyanosis. The nurse should assess the patients: A. Chest, B. Groin, C. Inhale beds, D. Sclera. The answer is C. Inhale beds. Question number 6. A patient has a chest tube inserted because of a pneumothorax. The nurse should explain to the patient that the purpose of the chest tube is to A. Apply suction to the chest cavity, B. Provide adequate oxygenation, C. Allow the compressed lung to re-expand, D. Drain fluid from the pleural space. The answer is C. Allow the compressed lung to re-expand.